Yes, exactly.
So the acronym PCOS stands for polycystic ovary syndrome. And essentially, it is the most common cause of infertility in the ovulatory sense. So essentially, PCOS involves a hormonal imbalance where a female typically has an elevated balance of testosterone as opposed to estrogen in her body, and that impairs the development of an egg and essentially prevents ovulation.
So is there anyone specifically who develops PCOS, or can anybody get this condition?
Well, certain patients tend to be predisposed to developing PCOS. And typically we think that there's an overlap between type 2 diabetes and PCOS. So those that are prone to develop diabetes, which really involves a significant portion of the population, can also be at elevated risk for PCOS as well.
So statistically, it says on average 1 in 10 women of childbearing age have PCOS. What are the first signs?
So one of the most common causes, one of the most common presenting symptoms of somebody with PCOS involves skipping menstrual cycles. So oftentimes patients may present saying that I only get a period a couple times a year, or for some reason I feel like I'm missing months at a time, and just have no idea when it can happen next. And that is that's a common presenting sign. Another symptom that patients usually present with is unwanted hair growth, particularly in the male pattern distribution, such as in the facial area, the chest, the breast, the lower abdomen. And that also is an indicator of testosterone levels being too high in a woman's body.
Is this condition, would you say that it's something serious and to be concerned about?
It can be. Women with PCOS, there's 3 things to worry about. In addition to infertility, which fortunately is quite easily correctable and treatable, tend to face a very high risk of type 2 diabetes. And it's imperative for us to reach out to patients at an early stage in efforts to try to prevent that from occurring, because diabetes has a lot of other bad sequelae that could be associated with it. Additionally, it's not healthy for women to not menstruate on a monthly basis, because if you go very long in between cycles, that would increase a woman's risk of endometrial hyperplasia, which is essentially precancer of the uterus. And that's something, again, that's quite preventable by proactive efforts of trying to restore menstrual cyclicity.
How is a PCOS diagnosed?
So the diagnostic criteria of PCOS continues to evolve, but essentially involves having 2 out of the 3 following: irregular cycles, signs of androgen excess, so essentially either elevated testosterone levels in the blood or having clinical evidence of high testosterone, usually presenting as unwanted hair growth in the male pattern distribution, as well as polycystic appearing ovaries on a pelvic ultrasound. So for all our patients that come to see us for fertility evaluation, we start off with doing a pelvic ultrasound after a history and physical. And essentially, a woman with polycystic ovary syndrome typically has ovaries that present in a very distinct manner, whereas the ovary tends to be much larger than usual and tends to have a higher number and density of follicles, which is where eggs develop in their primitive stage, and it's a very peculiar appearance.
So we had mentioned earlier that about 1 in 10 in the U.S. Have PCOS. How many patients would you say that we see at Fertility Specialists of Texas that have this condition?
PCOS is incredibly common in our patient population, whereas it affects, like you said, about 1 in 10 women nationwide. I would say about 30 to 40% of patients that present to us have PCOS. That could very well be a contributing factor in terms of their ability to have a child.
That seems like a lot that's coming into our office that have this condition, which kind of makes you wonder, if you have PCOS, can you still get pregnant on your own?
Absolutely. So PCOS related ovulatory problems tends to also be quite weight related. So when we initially see a patient with PCOS, we do a thorough workup to make sure that there aren't any other factors that could be contributing to the infertility as well. But from a simplistic fashion, some women, for example, losing just 10 pounds can start to improve their insulin resistance and can restore menstrual cyclicity, and they can end up being fertile on their own in that regard. So sometimes approaches are quite simple, and other times they tend to be more involved.
Which kind of leads me into my next question, is what fertility treatment options are available for someone with this condition?
So for patients where the remainder of the fertility workup is normal and it's mainly the PCOS that's the issue, typically I like to start off very gentle. And sometimes it's as easy as taking a very basic fertility pill that basically the goal is to help correct the hormonal imbalance for 5 days. For example, a woman would present, I would call us on her first day of her menstrual cycle, and we would do an initial ultrasound on the third day to make sure that the ovaries were nice and quiet, and initially take medication once a day for 5 days. And oftentimes that's enough to correct that hormonal imbalance and allow the body to develop and ovulate an egg on its own, and hence restoring fertility in a lot of patients.
So kind of one of the things that we hear a lot with infertility is that you feel like you have no control in the situation. And is there, and you had mentioned, losing weight just even a little bit can kind of help with this, with the symptoms. Is there anything else that women can do on their own to kind of improve their chances of conceiving either naturally or during their treatment cycle?
Absolutely. I can't overemphasize the impact of living a healthy lifestyle in terms of success with PCOS. And interestingly, they've done studies looking at various medications, including metformin, which tends to be a diabetes medication as well, and comparing that to lifestyle intervention. And the lifestyle intervention actually leads to better outcomes than simply medical management on its own. And what that involves is engaging in routine cardiovascular exercise at least 5 days a week for at least 30 minutes a day, as well as eating a relatively low glycemic diet. And one of the most popular ones that fits the bill is the Mediterranean diet. That is high in healthy fats and protein and fruits and vegetables, and minimizing the intake of processed foods. And another added benefit of that is doing this not only will increase a woman's chance of having regular cycles and hence restoring her fertility, but it will also alongside tend to decrease the risk of developing type 2 diabetes as well.
Awesome. So we know that this can cause issues with fertility, but what about during pregnancy once a woman is actively, successfully pregnant? Can this cause any concerns?
Well, fortunately, once pregnancy is established, PCOS doesn't tend to really significantly increase a woman's risk of adverse complications, with the exception of which is the diabetes. So, for example, if a woman is pre-diabetic or diabetic, it's very important to take proactive measures to help optimize the blood sugars. Otherwise, a woman would face a higher risk of miscarriage and as well as certain birth defects as well.
So I know this is kind of a weird question to ask, but is there an upside to PCOS? Because I've heard that, if someone's going through IVF and you have to do an egg retrieval, that women with PCOS tend to have more eggs.
So I guess that's one positive way of looking at it. So patients with PCOS, if you compare patients with PCOS to patients without at similar ages, women with PCOS tend to have a much higher egg count. So it is true that, for example, with a typical IVF cycle, women tend to have a higher egg yield on average compared to women without PCOS. That being said, we also have to be careful because there are certain risks as well that we have to be more mindful of.
Sure. Is there a cure for this condition?
So I always tell patients that we don't want to look at it that way. PCOS is not some horrible disease that we wish were gone or that we're seeking to cure. It's really recognizing a certain body type. We understand, in today's world, a large portion of the population is at risk for heart disease and diabetes and various cancers. So this is just I like to look at it as an opportunity to establish, to capture an at-risk population, to make an impactful difference in their lives in terms of preventing a lot of bad things that can happen early on without medication, lots of times, and just really having an opportunity to lead a healthier lifestyle that's more tailored to them.
So we're just going to kind of wrap up with one final question. Just really quickly, you are getting a lot of love in the comments, so congratulations. What's one piece of advice you'd like to offer to anyone who's watching this that thinks they may either have PCOS or know that they've been diagnosed and they're actively trying to conceive?
So in my experience, I come across a lot of misconceptions about PCOS, saying that, I should just ignore it, or it's normal not to have cycles or whatnot. The one piece of advice I'd like to put out there is to get help early, and one, not just for fertility purposes, but also to reduce the risk of diabetes as well as prevent endometrial cancer. It's very important to try to get help early and educate patients accordingly in terms of leading a healthier lifestyle.
That's awesome.